Hey, we have another cost comparison coming at you this time, and this video actually comes at the request of our friend with the username 80Deuce. He sent me an email with a situation that he experienced back in 2017. He is approaching important Medicare decisions, and he wants to know how Medicare would cover the exact same instance. So 80Deuce had heart complications and surgery, so I'm so grateful that you're still with us, and it makes sense why he would want to know how things would be covered under different Medicare plans. So 80Deuce, thank you for submitting this. For everyone watching, he requested that we compare original Medicare with a Medicare Supplement Plan G and an Advantage plan. So that is what we are going to do. 80Deuce already subscribes to our channel, and I'm not asking you to do that yet. I want to earn that. So at the end of this video, if I've earned your trust, we'll talk. This video is a cost comparison, period. This is not comparing how easy one plan is to use over another, networks, or the pros and cons of each plan. We have several videos on this channel that do all of that. This video is not that. It is strictly a cost comparison. Okay, so let's set the scene and outline some assumptions that we have to make on our trusty whiteboard. First, we were provided with the total billed amount of about $57,000. The insurance plan that 80Deuce had through work negotiated that bill down to $39,000. We will use this $39,000 number moving forward because once you go on Medicare, both original Medicare and Advantage plans are negotiating rates, and you'd be looking at a negotiated rate, not the billed rate. 80Deuce ended up paying $5,600 out of pocket. That is presumably the out-of-pocket maximum on his plan. Note that these costs were in 2017. It is 2023 today, so it's safe to assume that costs would be a bit higher now. 80Deuce did not have an itemized bill, so we need to break out where the services were to get an accurate payment structure, and we're going to make some assumptions. First is the ER visit. If a heart attack is happening, please get to the hospital. We will estimate that the ER visit is $2,000. Then the surgery to put in the stent we'll say is $28,000. And the inpatient hospital stay, which is actually a Part A expense and will come up later, is $3,000 per day. He was there for 3 days, bringing that total to $9,000. The two plans that we are looking at are original Medicare with a Supplement Plan G and an Advantage plan with an out-of-pocket maximum of $5,600. We're doing this just to match the employer plan to see how an Advantage plan would compare with the same max out-of-pocket with the company plan. Some Advantage plans have higher out-of-pocket maximums than this, some are much lower. Okay, with both of these plans, you'll have the Part B premium. The Part B premium is income-based. Those with low incomes, think Medicaid, will have a lower or no premium. Those with higher incomes will have a higher premium, but most pay the base rate of $164.90 per month or $1,978 per year. Okay, that's where the similarities end, and we can dive into this comparison. I'll start with original Medicare with a Supplement Plan G. The first thing is that to even have a supplement plan, you need to pay a monthly premium. This is usually age-based and it varies dramatically across the country. The average for a Plan G in our 5 surrounding states for a 65-year-old is $150 per person per month or $1,800 per year. In some areas, it's under $100 per month. In other areas, it's over $300 per month for a 65-year-old. The next is the deductible. With a Plan G, you are responsible for the Part B deductible. In 2023, that is $226 per year, and you pay that first before Medicare or your supplement will start helping. Okay, the emergency room charge of $2,000 is a Part B expense, meaning you need to pay the first $226 as your deductible. The $226 comes off of this $2,000 amount for $1,774, of which original Medicare Part B will cover 80%, or $1,419.20, and your supplement plan will take care of the remaining 20%, or $354.80. Moving to the surgery, since you have met your Part B deductible, and this is a Part B expense, you have no responsibility with a Supplement Plan G. Medicare will cover 80%, which is $22,400, and then your supplement plan takes care of the other 20%, or $5,600. This is one of the many reasons why people love supplement plans so much. You meet that Part B deductible, and then all Medicare-approved charges are covered 100%. Okay, let's go to the inpatient stay, which is a Part A expense. Part A has a $1,600 deductible here in 2023. Luckily, your supplement plan covers that, and your responsibility is $0. Medicare covers the remaining $7,400. Now let's look at the totals. Your total cost responsibility is $4,004.80, and that is made up of your Part B premium, your supplement premium, and your Part B deductible. Something to note is that that number is essentially your maximum out of pocket, because for the remainder of this year, should anything else happen and it is covered by Medicare, you wouldn't have any other costs. Okay, the cost to Medicare has a little nuance. The total is coming from the ER visit plus the surgery plus the inpatient stay. However, we're going to subtract the Part B premiums that you pay to Medicare from this total to give the out-of-pocket, if you will, for Medicare, and that number is $29,240.40. Your supplement plan has a similar arrangement. The total is the ER visit, the surgery, and the inpatient hospital stay, minus the premiums that you pay every year, for a total of $5,754.80. We can already see that in this instance, going on Medicare would have saved Eddie Deuce money over his company insurance plan, about $1,600 less on Medicare. But it is likely actually more than that, because most people still pay premiums that are taken out of their paycheck every month for their company insurance, and we don't have those numbers here. So the savings in this instance would actually be even greater on Medicare. Okay, let's talk Advantage plans. To have an Advantage plan, there may be a monthly premium depending on where you live, but for the majority of Americans on Advantage plans right now, they have a $0 premium. That number is 69% of all Americans have $0 Advantage plan premiums, so a substantial majority. Even if your plan is not a $0 plan, most Advantage plan premiums fall under $50 per month. Most Advantage plans do not have a deductible, and coverage begins immediately. This will be very important later. The ER visit is interesting because most Advantage plans have an ER copay. The average around here is about $100. However, most Advantage plans have the policy of if you have an ER visit and you are admitted into the hospital, the ER copay is waived. Since Eddie Deuce did get admitted, this copay would be waived. Also, most Advantage plans do have an ambulance copay. Around here, it's about $200. So Eddie Deuce didn't say that he took an ambulance, but if he had, there would be a copay for that as well. Once this whole ordeal becomes an inpatient stay, the Advantage plan has an inpatient copay. This varies by plan. It is usually a daily copay amount for a specific number of days. For example, $350 per day up to 5 days. If you're in the hospital longer than 5 days, your copay stops and the Advantage plan covers those charges. So Eddie Deuce was in the hospital for 3 days, giving a copay of $1,050. These copays are inclusive copays, meaning it covers the ER visit, the surgery, and the inpatient stay. So that is the cost responsibility for you. Medicare's responsibility for this situation? Zero, with an asterisk, and we'll get to that here soon. The plan is responsible for the negotiated amount minus your copay for a total of $37,950, also with an asterisk. Let's look at the totals. Your total responsibility for this scenario is your Part B premium and your copay for $3,028.80. Medicare is tricky again. It looks like it's actually positive of $1,978.80 because of your Part B premiums. However, Advantage plans do not take on this kind of risk out of the goodness of their hearts. They are compensated by the government for taking this risk. How much they are compensated varies widely by geography, their quality ratings, the type of risk that they take on, meaning the health condition of those they cover. But for this example, we'll say it's $1,000 per month or $12,000 for the year. Some are higher, some are lower. So subtract $12,000 from the $1,978.80 from Part B premiums, and we have Medicare on the hook for $10,021.20. The Advantage plan is paying $37,950 minus the $12,000 that they get from the government for a total of $25,950. Okay, now that we have all of these numbers, there are some interesting things to note. Number one, in this case, the Advantage plan would cost Eddie Deuce less out of pocket than both the supplement plan and his employer plan. This is just a snapshot of one situation. If anything else were to happen this year, that Advantage plan amount could go up higher. It could go up to that out-of-pocket maximum number plus adding in those Part B premiums, whereas the supplement plan is essentially maxed out in a way here. But wait, the Advantage plan and the employer plan have the same max out-of-pocket. How is the Advantage plan less? This is coming from the point that we made earlier about the deductible, or the lack thereof with Advantage plans. Most employer plans have a deductible, and many of them are high deductibles. With high deductibles, you need to pay that deductible first before insurance helps at all. The Advantage plan does not have that deductible and only has the copay in this instance. Deductibles and max out-of-pockets are not the same thing, and they often get confused for one another. The difference between them has major cost consequences in favor of the Advantage plan in this instance. Again, the employer plan does not have its premiums in this number, so the savings would be even greater. We get asked often whether somebody should stay on their company plan or go to Medicare, and the answer will depend on what your company plan looks like and what plans are available in your area. In this snapshot case, the Advantage plan is ahead. Okay, another important takeaway. These numbers do not include medications. Part D prescription drug coverage is separate. It does not come with a supplement plan, and you would need to purchase a standalone drug plan separately with its own monthly premium. The national average right now is right around $32 per month, or just under $400 per year for the premiums alone. Most Advantage plans have a Part D plan included at no additional cost. You are stuck with the formulary, which is the list of medications covered, and you're stuck with the tiers, or how those drugs are covered, of the insurance company offering that Advantage plan, whereas with a standalone plan, you can kind of pick and choose between plans that may cover your medications in a different way. But once on a Part D plan, whether standalone or included with an Advantage plan, the coverage is handled the same with different phases of Part D coverage that will likely have its own deductible, copays, and coinsurance amounts separate from these numbers here that we have on the whiteboard. 2 more takeaways left. Look at the cost to Medicare or the government or taxpayers, however you want to phrase that. In this case, again, this is not true of all individuals, but in this case, Medicare would spend $29,240.40 in the supplement plan scenario and only $10,021.20 in the Advantage plan scenario. That's just over a $19,000 savings on the Advantage plan. You can see how somebody who is healthy and has no expenses would actually flip that result and cost Medicare less in the supplement plan scenario because no claims means no costs. But with the Advantage plan, no claims still produces costs. Finally, we hear this a lot on these types of videos that there is no way this is true because insurance companies never lose money. I thought that they were nothing but evil, greedy, profit-hungry companies that only make profits. Well, that's not how insurance works. The insurance company doesn't just insure one person. Some companies insure millions of people, and their hope is that there are more healthy people at any given time than higher-cost folks. Insurance companies are not profitable on every single individual, not even close. They will lose considerable amounts of money on groups of individuals that have high costs. They will also net positive on a lot of other individuals. So in this case, the insurance company lost $25,950. Okay, AD Deuce, how did we do? For everybody else, if you found this helpful, did we earn that like and that subscribe that we mentioned at the beginning? We've done and we will continue to do more videos like this, so make sure that you subscribe to see other examples, including those where the supplement actually comes out on top or the employer group actually comes out on top, because they most definitely do in other situations. If you have a particular example that you'd like me to go through, or if you need help with your Medicare decisions, feel free to email me here. I appreciate you watching, and we will see you in the next video.